Hello, welcome to VMC. I'm Dr. M. Today we are going to cover Dirofilaria immitis, so join me, you'll learn something today. It's possible for heartworms to be present in any climate where the temperature and the humidity support mosquitoes. Mosquitoes are a crucial part of the life cycle, and so if there are no mosquitoes, then heartworm is not possible. It is endemic in all of the United States, save for Alaska. It's also found in parts of Canada, especially I think about places like Ontario. It's also present in other countries, Puerto Rico, Guam, etc. If it does get cold enough over the winter to kill off all the mosquitoes, that will slow heartworm transmission in those months. But if it doesn't, then heartworm transmission can occur year-round. We are seeing an increased spread in where heartworm are found. This is for a few reasons. One, as climate change occurs, we are having warmer areas for longer, which is promoting the ability for mosquitoes to live for longer periods of time. We are also having more urban sprawl, which is contributing to areas of warmth where the mosquitoes are able to reproduce and thrive. And we are also having more travel of dogs, both people with their pet dogs, but also unfortunate rescue situations where dogs will be taken from one country and shipped to another country. The domestic dog and some wild canids are the natural reservoirs for heartworm. However, cats and ferrets can also be infected with heartworm. Next, let's address the life cycle of D. immitis. This is important to understand because it helps to explain why we do the treatment and prevention options that are the current standard of care. The entire life cycle is between 7 and 9 months, and we will start with the microfilariae and how they get into the mosquito when the mosquito takes a blood meal from a dog that has heartworm. The microfilariae will develop into the first larval stage, and then from there they will go to the Malpighian tubules within the mosquito. After that, they will develop into the second larval stage. From there, they will molt into the infective larval stage, L3. The L3 larvae will then migrate to the mouth parts of the mosquito, and all of this occurs within about 10 to 14 days. It can be a little bit slower in colder temperatures. L3 larvae will be transmitted into a host when the mosquito takes another blood meal. The L3 will molt into the fourth larval stage within 9 to 12 days and then start to migrate through the host's subcutaneous and muscular tissues. The final molt to the juvenile stage occurs between around 50 to 70 days as the larvae is migrating. The juveniles will reach the pulmonary arteries of the host sometime after day 67 or so, and they will be roughly 1 to 1.5 inches in length at that time. Sexual maturity for D. immitis occurs around 120 days after infection, and females will be between 10 and 12 inches long when they are fully mature. Dogs will then have circulatory microfilariae around 6 months after infection, which is when they can then infect other mosquitoes who feed on them, and the cycle starts over again. Location of the adult heartworm is often within the arteries in the lungs, but it can also occur within the right side of the heart. If there is enough of a worm burden, it will overload the capacity of the heart and lungs to compensate, and you can have organ damage. You can also have heart failure, and eventually this will lead to death. Next, we'll move on to my favorite part of essentially every issue and disease, and that's prevention. The more prevention that I can help with, the better off we'll all be. Your pets will have fewer problems. I won't have to see them as often, which is great because I'm way too busy as it is. It's easier on your pocketbook. Everybody wins. Now, the specifics for prevention will vary a little bit based on your geographical location, and your local vet clinic will be able to guide you best about if and when your pets need to be on heartworm prevention. However, for endemic areas where heartworm is present year-round, we need to start puppies on prevention as young as 8 weeks of age. We then need to test them at 6 months of age and then every 12 months after that in order to make sure that they remain heartworm negative. This is because, as we've just learned, it takes 6 months in order to have microfilariae present in the body and enough adult heartworm load that our tests would be able to pick it up. If a dog is 7 months of age or older and we do not have their health history, we need to test both for antigens and for microfilariae before we put them on prevention. It's incredibly fortunate that we have several medication options. We have topical options, we have oral options, we even have some longer lasting injectable options. All of these medications fall under the same class of drug. They are all remarkably effective and wonderfully safe. These drugs all kill microfilariae. They also will kill the 3rd and 4th larval stages of heartworm. Now, skipping or delaying even one dose can leave your pet at risk and can result in them being infected. And the vast majority of the time, if we have a pet on preventions and on their yearly tests they end up being positive for heartworm, it is because of a human error, whether that error was with dosing or with timing. That said, there are some small subpockets of resistant heartworm populations, and so we need to make sure to use the most effective preventions possible for your individual geographical area. In areas with very high mosquito populations or very high heartworm infected populations, we need to consider multimodal prevention. Sometimes mosquito repellents and ectoparasiticides can be added into the heartworm prevention in order to be more effective. We also need to consider the environment and remove things that might harbor standing water where mosquitoes will replicate. Things like mosquito fish can also be considered, and it can also be somewhat helpful to have fans producing some wind in order to dispel CO2. It can also be very helpful to stay indoors during peak mosquito feeding times, so think dawn and dusk, but none of those are a substitute for keeping your animal on a heartworm prevention medication. It is true that some dog breeds, like some collies, will have an MDR mutation that can make them more sensitive to specific medications. One of the medications that they can be more sensitive to is the class that our heartworm prevention medications fall into. And we found out about this problem because overdoses occurred when these dogs were being given incorrect calculations of concentrated livestock medications. So it is not at all recommended to use livestock meds when dosing our dogs. We need to use a medication that is on label for dogs. And when we do that, the medications are safe even for the dogs that have MDR mutations. I hesitate to even put this in here, but I am in need of some of the foam that can be put up to reduce echo to help improve sound quality in the videos. So I will link a Ko-Fi. Please don't feel like you need to donate at all, and I understand if you do not. Please take care of you and yours first. That is way more important. It's more than enough if you comment on the video or like the video or share it with someone who you know needs the information. I really appreciate every time that you all do that. I do highlight a new comment every week. I am so grateful for all your comments, and I do read every single one of them. I do put out a new video most Fridays, so I look forward to seeing you next week. Thanks, and bye!